Let's look at the healthcare system and why it's so important to have emergency plans in place when a disaster hits. When we think of healthcare, one of the first images that comes to mind may be the hospital. It's a vital part of healthcare. Hospital staff mend our broken bones, restore blood flow to our hearts, and help stop infection in its tracks. But the healthcare system is broader than the hospital. There are public health agencies, pharmacies, behavioral health clinics, dialysis centers, EMS, and more that all provide vital services. The healthcare system includes people in all kinds of professions, people like doctors, nurses, technicians, administrators, and custodial staff. Some of us who aren't healthcare workers provide care to loved ones in our community when they're sick or need help. This is called informal care. Informal care from a family member or friend can help people get healthy and stay healthy. We all depend on the government and on infrastructure such as electricity, roads, and mass transportation to help the healthcare system and the community function. All of these pieces are constantly working together. This is exactly how the system is supposed to work. But sometimes things go wrong. What happens when a community is affected by a flood or tornado? What happens when the electricity is out and pharmacies close? Where do we turn when our informal caregivers can't reach us? Often, we turn to the hospital because we have nowhere else to go. The hospital does everything it can, but hospitals can get overloaded. When the effects of a disaster last for days, weeks, or even months, the workload in a hospital can become unmanageable. Let's see what this might look like for someone who has faced a disaster head-on. Meet Deborah. Deborah is 71 and has diabetes. She goes to an outpatient dialysis center 3 times a week. On most days, Deborah relies on public transportation to get there. Sometimes her daughter Rachel drives her. Rachel also provides other care to Deborah. She helps her with grocery shopping and picks up her medications. They've got a system that works for them. It helps keep Deborah healthy and strong so she can remain an active member of her community. When Superstorm Sandy hit in 2012, their system broke down. Storm surges caused flooding and resulted in hazardous conditions that shut down vital infrastructure and left millions of people without power and public transportation. Deborah's dialysis center closed, and Rachel couldn't get to her mother because the roads were only open to those considered essential healthcare workers. Deborah was left isolated and needed help. She turned to the hospital to get the dialysis treatment she needed, but the hospital was overloaded with patients who were injured, had serious infections, or were seeking comfort as the days grew cold and people became scared. It doesn't have to be this way. We can make plans and forge partnerships now to prepare our communities and the healthcare system for a disaster. Pharmacies, residential care facilities, and outpatient dialysis centers, like Deborah's, need to have emergency plans so they can function during a disaster. People depend on them every day. Patients and their caregivers should ask facilities about their disaster preparedness plans. When these services continue to function, patients get the care they need and the burden on hospitals is reduced. Private industries and not-for-profit organizations with mobile units can travel to affected areas to provide outpatient medical care or operate as a mobile pharmacy during a disaster. Local governments can consider the impact of road closures on informal care providers like Rachel, whose friends and family depend on them. Keeping people out of unsafe areas is important, but it's also crucial to provide pathways that allow the community to step in when they need to. A system without these plans in place simply doesn't work well. It leaves people like Deborah isolated and hospitals overloaded. When we understand how healthcare and the community are connected, we can make sure we're ready so everyone can stay safe and healthy, even when a disaster strikes. To learn more about how your organization can make sure it's taking steps to be prepared, visit disaster.nlm.nih.gov.